Your heart works all day, every day. It pumps blood to every part of your body. When you are still and calm, your heart beats at a slower, steady pace. This pace is called your resting heart rate, or RHR. Think of it as your heart's baseline speed. It is the number of times your heart beats in 1 minute while you are at complete rest. Doctors watch this number closely. It gives them a quick snapshot of your heart's health. A lower RHR often means your heart muscle is strong and efficient. It does not have to work very hard to pump blood when you are not moving. Tracking your RHR can be a simple way to check in on your overall well-being. It is a piece of personal health data that is easy to get. Small changes in your resting heart rate over time can tell a big story. They might show that your fitness is improving. They could also be an early warning sign that something is off. For instance, just standing up after sitting for a long time can make your heart rate jump for about 20 seconds. The temperature of the room, or the weather outside, can also have an effect. Your heart might beat a little faster in hot and humid conditions. Even your emotions play a part. Feeling very excited, anxious, or stressed can raise your heart rate. That is why it is important to measure your RHR when you are truly relaxed. The best time is often right after you wake up in the morning before you even get out of bed. Understanding your personal RHR is a powerful tool. It is not just a number for athletes or doctors, it is a vital sign for everyone. So, what is a good number for your resting heart rate? For most adults, a normal RHR falls between 60 and 100 beats per minute. A rate below 60 is called bradycardia. Above 100, and it's known as tachycardia. These terms do not automatically mean there is a problem. Context matters. Many factors influence your RHR, including age, fitness level, and genetics. People who exercise regularly strengthen their heart muscle. A stronger heart pumps more blood with each beat, so it needs fewer beats per minute to supply enough oxygen. Healthy young adults and well-trained athletes often sit between 40 and 60 BPM. Some elite endurance athletes are even in the 30s. On the other hand, being overweight can push RHR higher because the heart works harder. Stimulants like caffeine and nicotine raise heart rate. Stress and anxiety trigger fight or flight, increasing RHR. Women tend to be about 2 to 7 beats per minute higher than men on average. Illness and infection can also drive your resting heart rate up. Your RHR varies day to day. Know your personal average, not just a single number. If your RHR is consistently above 100 at rest, and you are not sick or stressed, talk to a doctor. An unusually high RHR can be linked to issues like an overactive thyroid or an arrhythmia. Likewise, a very low RHR with dizziness or fatigue should be discussed with a healthcare professional. Seek care promptly if high RHR comes with feeling dizzy, shortness of breath, chest pain, or heart fluttering. A low number can be normal for athletes but not always for everyone else. Context and symptoms matter. When in doubt, get checked. You can measure your RHR at home, ideally right after you wake up. Be relaxed and still. Use your index and middle fingers. Do not use your thumb. On your wrist, place them on the thumb side and press gently until you feel the beat, or on your neck just beside your windpipe. Press lightly. Count for 15 seconds and multiply by 4, or count a full minute for accuracy. For example, 16 beats times 4 equals 64 BPM. Watches can track automatically and show trends, though single readings can be off. Skin tone, tattoos, and strap fit affect readings. Focus on trends over time. If your RHR runs high normal, you can improve it. First, get regular aerobic exercise to strengthen your heart. Second, stay hydrated and limit alcohol. Third, cut back on caffeine and avoid nicotine. Fourth, manage your weight. Less strain on your heart can lower RHR. Fifth, reduce stress with deep breathing, meditation, or gentle yoga. Calming your nervous system helps lower your heart rate. A single high or low reading is usually not a concern. Consider coffee, stress, or poor sleep. If you feel great and your RHR is in the 50s or 60s, it often reflects good fitness. What matters most is your trend over time and how you feel. If your RHR is consistently over 100 at rest, get medical advice. If a very low RHR comes with fatigue, dizziness, or fainting, have it evaluated. Your resting heart rate is one piece of your health puzzle. If you have concerns about your heart rate, consult a doctor. Do you know your average resting heart rate?